So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after let's discuss this test step by step. So it's 35-year-old man. He complains on fatigue and also he has darkening of the skin. From his anamnesis, we know that he has diabetes type 2 and hypertension. For diabetes, he intakes metformin. With metformin, we always have to keep in mind that the major side effect of metformin is lactate acidosis. And for hypertension, he intakes losartan, which is angiotensin II blocker. We know that this group of drugs cause hyperkalemia. From physical examination, we know that he has hepatomegaly. In his biochemical analysis, we see increase in AST and ALT, which tell us about liver injury. What is important with liver enzymes is to know which enzyme is elevated more. In this case, the elevation of ALT is higher than elevation of AST, which means that it's not alcohol that caused liver injury, it's something else. He has significantly elevated ferritin level and increased transferrin saturation. When we see both of these values elevated, we immediately think about anemia of chronic disease as the most common cause of elevated ferritin. But also, it can happen in iron overload, for example in hemochromatosis, which is extremely rare disorder. In this case, patient has no anemia, and he has liver injury, which suits hemochromatosis. And elevation of both AST and ALT with higher level of ALT is also characteristic. Hepatomegaly in hemochromatosis is also present due to the inflammation caused by iron overload in the liver tissue. But the most important sign is darkening of the skin, because it's a very rare symptom, and in case of hemochromatosis, this symptom is present. We call this disorder bronze diabetes. Recall that free iron easily reacts with hydrogen peroxide, which results in production of iron and hydroxyl radicals. Hydroxyl radicals are active oxygen species, which means that in high concentration they can cause severe oxidative injury. So yes, in this case, patient has hemochromatosis. To verify the diagnosis, we should test him for the presence of HFE gene. But what is the right answer? It's definitely not discontinuation of metformin. This option will be correct if patient had lactic acidosis or severe renal failure. Oral prednisolone we usually use to inhibit lymphocytes in autoimmune disorders, which is not the case here. Penicillamine is a drug of choice for Wilson disease, where we need to chelate copper. Ursodesoxycholic acid we use for primary biliary cholangitis. In this case, there are no evidence of cholestasis, so it's not the case here. So the correct option here is phlebotomy. The reason why phlebotomy helps is that red blood cells consist of cytoskeleton and hemoglobin consists of heme and globin. In turn, heme is iron and protoporphyrin. So when patient have blood loss, he loses red blood cells, and because one of the red blood cells components is iron, it helps to decrease the amount of iron in the organism.